Have you ever told your brain to stop thinking so that you can sleep? Hi guys, I hope you all are safe. I'm Dr. Shruti Ajmera and I welcome you to Brainvibe. So today we are going to talk about insomnia. So what is insomnia? We all know that it is a condition or disorder in which people have trouble in falling asleep. So it can be for a short time, which is called as acute, or for a long time, which is called as chronic. Now let's discuss some common causes of insomnia. First, stress. Stress causes insomnia, and surprisingly, inability to sleep also increases your stress. Second, improper sleeping schedule. So our body has its own cycle, which is called as circadian cycle. So if you are altering it, that means you are working extra at the night time, then you are actually causing disturbance in your sleep cycle. Third, phones, electronic devices, online chatting and social media. So we all are aware of this, right? People stay up online to play games or on social media or chatting. Fourth, naps. So if you are sleeping too much during daytime, then obviously you will find it hard to sleep at night. Fifth, caffeine. Taking stimulants just before the bedtime is not a good idea. Sixth, if you are suffering from other medical conditions like respiratory disease which worse during the night time, then this is called as secondary insomnia. So insomnia has many effects on our body. It causes anxiety, depression, stress, lack of motivation and focus and lack of coordination, which increases the chances of mistakes and errors in your work. Now let's discuss what are the approaches to manage insomnia. First of all, just keep your phones and electronic devices away during the sleep time. Make a proper schedule when to go to bed and when to wake up. Initially it will be difficult, but after some time you will be habitual. Make your room comfortable without any noises or lights and temperature according to you. Avoid caffeine and alcohol during the night time. Try to do some exercises. And if you have any other medical conditions, then you should consult your doctor. So all of these were non-pharmacological methods. Now, if these are not working, then you should consult your doctor and he might prescribe you some medications for the same. So now let's discuss some pharmacological methods. So your doctor can provide you with cognitive behavioral therapy for insomnia, that is CBTI. He might prescribe you with some medications like sedatives or antidepressants according to your condition. And melatonin producing agents. So melatonin is responsible for our sleep and wake up cycle, that is called as circadian cycle. So that's it for today guys. I hope this video was helpful to you. If you like this video, subscribe to our channel and press the bell icon for more updates. Till then, stay fit and stay happy. Thank you.